Welcome to this explainer. Okay, today we are unpacking a literally life or death area of artificial intelligence, personalized healthcare agents. Now, we aren't just talking about your AI remembering your dog's name or the fact that you love pepperoni pizza. No, we're talking about flawlessly precise clinical tracking where a single AI hallucination could have absolutely severe consequences. As AI transitions from those basic, everyday chatbots to lifelong health companions that could serve millions of us, the demands on their underlying memory are just skyrocketing. So today, we're diving into a groundbreaking study that introduces MedMemoryBench. It's a rigorous stress test that reveals some pretty surprising vulnerabilities in our current state-of-the-art models. Let's get into it. Here is our agenda for the explainer today. We'll start with the medical memory problem, then cover building a realistic benchmark, move on to the streaming assessment protocol, look at testing under pressure, examine the high cost of memory, and wrap up with the future of medical AI. All right, Section 1, the medical memory problem, precision or peril. Think about it like this. Existing benchmarks for AI memory mostly focus on casual, everyday conversations. If your AI forgets that your favorite food is pizza or that you're super into jazz music, well, it's a minor bug. It's just a slightly annoying user experience, right? But clinical memory is a whole different ballgame. If a healthcare agent hallucinates or overwrites a severe latex allergy or somehow fails to notice that a patient's fasting blood glucose has crept up from 7.2 to 9.8 over a few days, that is a fatal flaw. In medicine, complaints that sound semantically similar, like a vague diffuse abdominal pain versus a sharp right lower abdominal pain, dictate entirely different, critical diagnostic pathways. It requires absolutely zero-tolerance factual retrieval. There is no room for error. And this perfectly illustrates the real clinical need. It spans 4 crucial dimensions. Up in the top left, we've got safety-critical personalization. General AI doesn't really distinguish between strong and weak facts, but in healthcare, a sensitive detail like a drug interaction has to be firmly locked in. On the top right, longitudinal clinical progression. A medical AI has to track how your symptoms change over months of treatment, like monitoring your sleep apnea pauses over an entire year. Down on the bottom left, streaming memory integration. This shows that real clinical workflows involve accumulating data dynamically, on the fly, which influences future doctor visits. And finally, on the bottom right, noisy memory accumulation. Because let's face it, real interactions aren't perfectly clean. They are filled with family chatter and random health questions that act as conversational noise, which really pressures the system's memory limits. Moving right along to Section 2, building a realistic benchmark, the MedMemoryBench pipeline. So how do you actually test this stuff without risking real patients? To synthesize these long-horizon medical trajectories, the researchers developed this incredibly elegant, collaborative pipeline between humans and AI agents. Step 1 starts by generating a clinically grounded patient profile based on real-world, de-identified cases. In Step 2, the system maps out a year-long diagnostic report, complete with hidden trap events like a sudden allergic reaction. Then, Step 3 simulates over 100 interaction turns between a patient agent and a physician agent, organically building up memory along the way. Finally, in Step 4, multiple specialized agents extract those memories and construct expert-verified test questions. Ultimately, this generated a massive, robust data set of about 2,000 sessions and over 16,000 interaction turns. Notice how this closed-loop generation actively flows from start to finish. Over on the far left, a patient profile for obstructive sleep apnea kicks off the disease progression. Then, in the second panel, specific clinical checkups and a really crucial latex allergy trap are deliberately injected into the timeline. Moving to panel 3, we actually see the simulation of dozens of sessions unfolding over months, from January all the way to September, recording summaries after every single interaction. And finally, panel 4 shows the multi-agent refinement. A trap agent extracts the tricky facts, a query agent drafts the questions, and a critique agent double-checks the scores, all leading to a final human expert review. It's a remarkably rigorous way to build a stress test. Section 3, the streaming assessment protocol, evaluating in real time. Here's the thing. The researchers realized that static, one-time tests are basically useless for an AI that's supposed to act as an ongoing, everyday health companion. So enter the evaluate while constructing streaming assessment. Instead of cramming all the data into the model at the very end and just grading it once, which, by the way, is what older benchmarks do, this method forces the AI to accumulate and retrieve memory sequentially. It processes dozens of sessions, extracting and organizing memory continuously, and then gets quizzed at random points along that timeline. It actually has to maintain long-term coherence, exactly like a real doctor tracking your health over a year of visits. The researchers summed up the ultimate goal perfectly with this quote. Ideally, an agent should function like a human physician by progressively refining its knowledge and evolving its capabilities as clinical experience and the memory store grow. This really highlights the massive gap between the generic chatbots we use today, which treat every single conversation as an isolated event, and the true, deeply personalized healthcare agents we actually need for the future. All right, Section 4. Testing under pressure. The results reveal critical flaws. Time to look at the hard data. To set the stage, the researchers tested a lineup of heavy-hitting open-source memory methods. We are talking about systems like 𝗏𝗏, 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 𝗏𝗵, and MemRL. Now, don't worry too much about the acronyms. These are simply different architectural strategies for how an AI files away and retrieves its memories. But here's the kicker. All of these were powered by a state-of-the-art backbone, GPT-5.1. They were evaluated across 4 absolutely rigorous dimensions: precise factual retrieval, accurately updating a patient's clinical state, implicit reasoning across multiple data points, and overall system robustness against noise. Let's look at the actual accuracy numbers, because this is where things get really interesting. The solid blue bars show how the models perform in clean, perfectly curated scenarios, but the hatched pink bars? That shows performance when realistic noise is introduced, things like family members chiming in with questions, or general health queries that just pad out the dialogue history. Notice the alarming visual drop across the board. Even top performers see their accuracy noticeably suppressed the moment everyday noise is added. When the agent has to dig through conversational clutter to find a critical medical fact, it stumbles. Think about the real-world consequences of that. Literally missing a drug allergy just because the AI got distracted by a random question about the hospital cafeteria. And this graph brilliantly illustrates what we call memory saturation. Notice the drop in F1 scores, which is just a metric that tracks both the accuracy and the completeness of the AI's memory. As the patient's file grows over a year and fills up with tons of interactions, the agent's ability to pull the exact right data degrades severely. The system simply becomes saturated. The pink hatched bars are consistently lower, proving that a sustained influx of information actively degrades the retrieval robustness of these models. In plain English, they suffer from pulling up too many irrelevant facts and completely missing the life-saving ones. Now, you might be thinking, well, the fix is easy. Just feed the AI larger chunks of text so it has more context. But look at the chunk size dilemma mapped out here. We're looking at accuracy across 1024, 4096, and 8192 token chunk sizes, basically how much text the AI is allowed to read at once. While moving from 1024 up to 4096 generally improves performance by giving it more complete medical context, look closely at what happens at 8192 for methods like 𝗏𝗏. The performance trend isn't a straight line up. Supplying all that extra context eventually dilutes the critical medical data, causing the AI to completely lose the signal in the noise. Section 5, the high cost of memory, time and tokens. Because the problem isn't just accuracy, it's the sheer computing power required. Check out the staggering spikes on these solid blue lines. The blue lines represent the computational cost just to build and organize the memory, while the dashed orange lines represent the cost to actually ask it a question. For 𝗏𝗏, the time cost to build memory rockets all the way up to 140,000 seconds. And over on the token graph, 𝗏𝗏 consumes a massive 157 million tokens just to organize the long-term data. Why? Because mapping out complex webs of medical relationships consumes an astronomical amount of background processing. Sure, the cost of answering a single query is low, but the background maintenance, extracting entities, building relations, checking for conflicts, it creates a total infrastructure nightmare. When we summarize these memory methods into categories, unstructured like BM25, graph-structured like 𝗏𝗏, and flat extracted like 𝗏𝗏, we see a really clear bottleneck. Unstructured methods are kind of like tossing patient files into a messy drawer. They're cheap and fast, but they fail completely at complex reasoning. On the flip side, complex architectures like 𝗏𝗏 attempt to meticulously map out every relationship. It's like hiring a painfully slow, meticulous librarian, highly accurate, but creating a severe efficiency bottleneck when you're trying to maintain it long-term. Currently, none of the paradigms strike the perfect balance of high accuracy, noise resilience, and operational efficiency that healthcare absolutely demands. Finally, Section 6, the future of medical AI, a call to action. Where exactly do we go from here? Well, MedMemoryBench definitively proves that our current state-of-the-art memory methods are fundamentally unready for the high-stakes reality of large-scale clinical deployment.
A sustained influx of information actively degrades their retrieval and reasoning robustness. They suffer from memory saturation, they struggle to filter out everyday conversational noise, and they cost way too much compute to maintain longitudinally. Think about your own future healthcare for a second. If an AI companion is going to track your health from your 20s well into your 80s, it simply cannot afford to lose the critical details amidst the noise of everyday life.
Which leaves us with this provocative question. If our best top-tier AI agents still drown in medical noise and struggle to remember vital contraindications over time, are we truly ready to hand them our health data? The vision of a lifelong AI health companion is incredibly powerful, for sure. But as this benchmark exposes, there are massive leaps in engineering and architecture required before we can safely trust these systems with our lives. Thank you so much for joining me for this explainer, and keep questioning the data.